welcome. I am, again, Celeste Vaughan-Briggs, an ecology social worker. I'm going to share my slides now so that we can get into the meat of this program. This topic is so important. It touches so many lives. Once you have heard those first words, I have cancer or you have cancer, the worry starts then for many people. And we want to talk about kind of what that journey and trajectory looks like and some strategies for what helps, much of which you already know and likely are doing already. So let's get started. What we're going to go over today is just generally a little bit of data, not too much heavy on the data aspects. Our presentation last week was so wonderful with so much good information, and I couldn't follow that up if I tried. But I do want to talk a little bit about the psychosocial data and talk about the fear of recurrence using just kind of three buckets or categories. They aren't the only buckets or categories, but just three ways, three areas and topics that sometimes it's easier to organize how we think about these issues. We're going to talk a little bit about some strategies, and then we'll take some questions. So my next slide, most people like. So, in social work and in helping professions, there is a technique and tool called a community meeting. It comes out of Dr. Sandra Bloom's work, who works with trauma folks impacted by trauma. And we're going to just do a modified community meeting. Basically, who in your circle can you ask for support? And part of the process of asking for what, identifying how we feel, identifying a goal we want to achieve, and then who in our community can help us. So you could potentially put that in the chat. You can think about it to yourself, but how are you feeling right now? What do you notice in your body? What thoughts are coming through your mind? Uh, what are those feeling words that you're associating so you can ground yourself in the here and now? What's your goal for today or for tonight? Is it to get some information that you find relevant? Is it to maybe connect with someone in the chat? Is it to see yourself as larger part of a bigger community? And then who can you ask for help? You can ask all of us for help. You can ask in the chat. You can ask in Q&A. You can follow up with other programming that LBBC has. Maybe you can even turn to friends and family in your circle of support. You can ask for help. So that's our little community meeting to get started. So last week, the presenter really went into the deep dive data, and I just want to kind of give a general overview in that we know that breast cancer is one of the most highly diagnosed cancers in the United States. This data is from the American Cancer Society and their estimates. Knowing that you are part of a growing number of people who are impacted by this disease, it's a little six one hand, half a dozen in the other. You are part of a larger community of folks who have navigated challenges and difficulties, treatment decisions, and have come out the other side through survivorship, support from family, friends, organizations. But it is a club you did not want to join. You did not want to hear those words. And knowing that others are going to be introduced into that experience can feel a little challenging. It can feel both I'm part of a community, but I really don't want to be part of that community. And that's okay, that kind of paradoxical tension. But I show that to say that there are others like you. The other piece about this, and the presenter last week really did go into this from a medical framework. I am not presenting this as a clinician. I am just giving an overview that there have been great breakthroughs in science, and where we have come from to where we are, even though this particular data, this is again from the American Cancer Society, shows from 2014 to 2020, that survival rates have continued to improve for all cancers, breast included. And so that even though we know there are more people being diagnosed, more women being diagnosed, and some men, and we know that people are surviving, and surviving longer, and more survivors of um, so you're in that greater circle of support. That framework sometimes for some people, and all of these strategies do not work for everybody. So you do have to kind of see what works for you. But for some individuals, that context is helpful to ground them when moments of fear, distress, worry, and anxiety happen, to see yourself as part of a larger story of survival, survivorship, of science and technology moving forward, and seeing yourself as part of a community that has resiliency and strength. So hopefully that is helpful for some folks. If it is not, you can leave it where it is. So let's talk a little bit about cancer related distress. Um, for those of you who have been through the treatment experience, there may be some caregivers on the line on the webinar as well. You may have gotten some questions at some point in your journey, either from a nurse navigator, social worker, a nurse. You may have been handed a little thermometer, or you may have been asked a series of questions asking you about how you were emotionally feeling, and psychologically processing what was happening. They were trying to identify your distress. We know that a cancer diagnosis is one of the most stressful experiences that a person can have, that an individual can have. Even when the news is hopeful that there are treatments identified, that there's curative intent, as they say when you're being seen by a clinician. Um, Nonetheless, the psychosocial impact of a cancer diagnosis really does hit along all aspects of life. So these distress symptoms or distress areas are things that clinicians will ask about or other members of the care team. What are they? They're commonly identified and expressed as emotional experiences: fear, worry, and helplessness. Absolutely. Absolutely. That is a human condition. Sadness, feeling regret, longing, um, longing for the world as it was before you heard those words. Um, Sadness of being part of this larger community that you did not want to be, which can be particularly challenging, although it's not worse or better, but challenging in a different way for our survivors who also have genetic mutations, because sometimes there are family history stories that can also impact our emotional experience and distress. Um, Depression, anxiety. So depression and anxiety are psychological concepts. It's sometimes helpful to think of them along a continuum. Maybe one end of a continuum may be a clinical diagnosis given by a psychiatrist, a psychologist, licensed professional counselor, marriage family therapist, or social worker, or other clinician, where you meet criteria for a DSM-5 diagnosis. Um, but often it can be uh, pieces of that criteria. You might not fit all of those, but that does not minimize your experience of having impact to your activities of daily living, sleep disruption, appetite disruption. So you may be at one end of the continuum, not necessarily. Uh, being diagnosed with a mental health condition by a clinician, but you're hurting, you're impacted. Anxiety is similar in that regard, again, along a continuum. Your activities of daily living, sleep, eating, concentration, those can be impacted, those distress symptoms. Concerns about the illness and the treatment, um, feeling isolated from family and friends. Again, this is very common. Um, I talk to people every day. I talk to newly diagnosed folks. I talk to people in survivorship, but people a little bit further in the journey, sometimes as they are reconnecting to a larger community of support, they will often talk about how in the beginning it was really challenging because maybe they didn't have anyone in their cohort, in their family, in their friend group that had ever gone through it. So they felt quite alone. Uh, so that can increase our feelings of distress and frequent thoughts of illness and death. Now, listen, being diagnosed with an acute or chronic or serious illness, reckoning with our mortality is part of the human condition. So I am not pathologizing that. There's no kind of right or wrong about that. However, when someone sees a mental health professional or when we're assessing for the level of distress, how impactful it is or disruptive to your daily life. And those are the things that we really want to know about because we want to try and help get you the support that we can. So, what does the research tell us about the impact of a cancer diagnosis? Kind of similar to, and these things can sometimes amplify our feelings of distress, and sometimes they can mitigate our feelings of distress depending on our own circumstances. Um, Life is turned upside down, disrupted routines. Uh, we know that often women who are diagnosed function in so many roles in their households, in their employment, in their jobs, in their family group, in their friend group. So, now having on top of, doing the laundry and getting the kids to practice and getting dinner and going shopping, now I have to fit in, medical oncology and radiation oncology. And boy, I have to get this scan, and they could only fit it in for me, at 2 o'clock in the afternoon, when that means I have to take off work again. And now I had this report I had to have done. That disrupted routine can amplify stress. It can impact our cycles, whether that's sleep, having those moments where, you had a chance to just, I don't know, play the latest little game on your phone just to decompress. Well, you don't have that time anymore now because you have to keep going, going, going. The physical impact of disrupted sleep patterns, nutrition being impacted based on the treatment that you're having, new health issues that pop up as a result of the treatment, or post-treatment, which is something that the clinical team really does need to take and pay more attention to. They're getting somewhat better, but that is often something that I hear from folks all along the continuum of care that they kind of wish the care team paid a little bit more attention to is post-treatment side effects because that also increases the level of distress because it's not talked about. Is this a normal post-treatment side effects? Is this something new? Is this something I should be concerned about? And then that can amplify that fear of recurrence. The emotional impact, which we've talked about. Um, if there have been periods in our life where we have struggled in the past or, overcome in the past and, found strategies and tools to deal with challenging issues or concerns that have come up in early childhood or young adulthood or later in life, having a new disruptive event, again, one of the most stressful things that you can have happen can amplify existing distress. And there may be new tools that you have to add to your toolbox and getting that support. And then changing roles, I kind of alluded to talking about before. That's unpredictability that impacts our households, if we're caring for children and caring for elders. Those types of issues really can amplify the distress of an individual. And again, that can be while you're in active, newly diagnosed, and active treatment, and well into survivorship, because it will look different at different stages. And often, when you are in your journey of survivorship, when new events happen or new fears or worries pop up, sometimes people feel transported back to a previous era, and they are reliving it. Not in the same way as a flashback, but they are re-experiencing what that is, and that can amplify distress. So let's talk a little bit about defining fear of recurrence, which is actually in the literature. There are lots of um, uh, journal articles. If you do want to dive into it, psychosocial oncology research um, is really tailored to try to identify these issues, kind of to get a handle on it so we can think about how do we best come alongside and support folks. Um, and this is an interesting article. It's a little bit older, but not too old. And I just want to kind of highlight that definition, that the fear of cancer recurrence, or FCR, has been described as the sword of Damocles that hangs over survivors for the rest of their lives. FCR is usually defined as the fear or worry that the cancer will return or progress in the same organ or another part of the body, and that associated with it can have increased impairment in functioning, increased psychological distress, and stress response system symptoms that can lower the quality of life. So it is a big deal. And we want to talk about some ways and strategies to address it. But I do want to just emphasize this is real. It's an important topic. It's being researched, and just to help you feel seen. So remember I talked about those buckets? So let's go back to the buckets. Because there's a million buckets of distress and worry, but I'm going to talk a little bit about the life bucket, and that fear of recurrence in the life bucket. Um, there are so many decisions that we make on a daily basis, um, some of which end up being rote, under the radar. We don't think about, and they become part of our routine. But when we have that disruption, we have to think harder about the next decision. And also, we worry or wonder about previous decisions that we've made. What are the impacts of those decisions? And we are looking for some predictability and control. That, again, to normalize that is a human condition. Looking towards predictability and control in situations in which we feel are out of our control is something that we do. There's nothing wrong with you for aiming towards that. That is absolutely understandable and common. In these types of situations, and as medicine has evolved and they talk about patient-centered and patient-driven care and shared decision-making models, you might have heard some of this from some of your clinicians. Sometimes it's presented as, look how great we've come. We're moving away from a strict patriarchal medical model where a doctor says do X, Y, and Z, and the patient says, yes, ma'am, yes, sir, and just does it. We're more in a collaborative relationship, and we are moving together towards, addressing the pathway to care. Well, that's true, but in some ways, it can feel overwhelming. All the alternatives and uncertainty. Did I make the right choice? Um, What about the consequences of the choices that I made? I made this, the doctor gave me an option between A and B. I chose B, and now I'm having some, long-term side effects. Maybe if I had chosen A, that would have gone differently. And we have a lot of counterfactuals. Again, very common in cancer, but also in other medical conditions and acute care conditions, but it's also common in life. So what strategies may be helpful, and this would be something to think about. When you have made decisions in your life before, when you have approached it, making the best choice you could with the information and resources available to you at that time, you did the best you could. And to try to, kind of work through a process. A therapist can be very helpful with this. Sometimes they do techniques such as cognitive behavioral therapy to really kind of get in the nitty gritty of your thought process. But to come to a place where you are able to um, work towards kind of a more helpful homeostasis when reviewing past decisions when it comes to life related to the cancer diagnosis or choices you've made, which, facility to go to, etc. Okay. Our second bucket. Now, this bucket is a bucket I walk alongside. The care team drives this bucket, but the worry category, the diagnosis itself, and the medical issues. It's similar to the life category and kind of the decisions and uncertainty, but it's a little bit different. And um, you know, I want to talk a little bit about the complexity that is compounded in modern medicine, right? And I want to empathize and really uh, just give you all of the props and kudos and just all of my love and support because it is so challenging to sit in the room and hear all of this information spoken in a different language, medicalese, as it pertains to you. And I have sat alongside folks who are also clinicians or nurses or have other medical training. When it's you, you just can't process it in the same way. And that bucket of worry can also impact your fear of recurrence and that uncertainty because it is amplifying, did I make the right choice or is my team making the right choice? And sometimes um that also can be because we're all human beings, right? Doctors aren't perfect, nurses, social workers, none of us are perfect. And the complexity can be compounded by the healthcare system's uh, inefficiencies, challenges, things that we just don't do as well as we could, things that we're striving to get better at, siloed communication, um, doctors not necessarily or care teams kind of asking you, the patient, so which treatment is this? Which doesn't necessarily kind of inspire confidence. And you know why they're doing it. That's kind of their verbal cue to themselves to familiarize themselves. Sometimes they do a teach back to try to see how or gauge how much you know about the process, but sometimes there can be a little tension in the communication of that. So that can certainly be a concern. Barriers, and this is what we're going to talk a little bit about, kind of that worry category, the society and community, there can be these barriers that impact how frequently we can get back to see our team and what's kind of going on, and that can what's going on in the larger context of the world, and that can impact how we interact with our teams and increase and amplify our fear of recurrence. So I want to talk about the bucket of community worry and societal worry. So I'm going to put on a little teaching hat. I'm not getting into all of public health, But there is a particular, it's often used in public health theory, um, this concept around social ecological theory, which was partially developed by Yuri Brenner. And it really, and you can see that very big circle that has ever smaller circles in it, kind of puts we, the individual, in the center of these other, kind of concentric circles, these other areas of influence and support, that they are mutually influential. We as our individual, but we are connected to our finances and, you know, the impact of the physical impact of the diagnosis that impacts how we work alongside friends and colleagues, how socially engaged we are in our interpersonal relationships. Um, are we connected to larger organizations, either as an engagement strategy in a helpful way, like LBBC or other organizations? Maybe there are um, uh, other opportunities for you to engage, to feel connected, and to kind of channel your worries and concerns. Are we connected to our community, right? Um, where we live, where we work, where we play, which really kind of gets to the factors such as the social drivers of health. You may have also seen that or gotten asked questions about that in your care journey. Um, the social drivers of health, again, a public health concept, but is increasingly adopted across many health systems to really kind of get at what are the other important factors that impact an individual's situation beyond just the physiological and disease factors, and saying that it's important. You know, uh, you know, do we have access to healthy food? Are we experiencing financial toxicity as a result of the diagnosis? Um, are we having transportation barriers? Uh, are we depressed? Um, do we have um, other impacts? Is it difficult for us to obtain our medication due to those financial factors? It's important to ask about that. Um, that can help a care team. Now, social workers, we aren't the only ones that ask these questions or try to address the issues that may come up. Your nurses, your nurse navigators, doctors, other clinicians, and even some health systems, medical assistants are asking some of these questions. And it's to say, can we help connect you, community health workers, to someone who can help address this worry? Because sometimes the worry is, t- and this is difficult sometimes for the care team, sometimes the cancer diagnosis and the things that come from that are as imp- are super important, yes, but so is my rent just went up, and now I'm going to miss work, and I don't know I'm going to make my rent, and I'm worried. My child is, really now starting to do well in school, and I'm worried with all of this focus on these other issues. Something's going to happen, and that's going to take them off track. And that is important, and your care team should respond to that. So please, you know, please, if you are asked those questions, answer as honestly as you feel you can. If you already know or can identify those issues, let them know. Let them know, and then maybe we can try and address it. So let's say what helps. Are we looking at a glass half full or a glass half empty? Um, sometimes it's both. That paradox is okay too. Who can you share your frustrations with? What works for you? When we're thinking about psychological and emotional wellness, um, kind of making an inventory of the tools in your toolbox. How have you gotten through difficult times in the past? Because you surely have. What family and friends are part of your network that are more helpful to you? Um, do you have support groups in your cancer center or outside in other organizations like LBBC? Are you connected to complementary medicine, which can be a helpful adjunctive way for folks to kind of calm themselves, address anxiety, things like acupuncture, yoga, massage, Reiki. Sometimes they're cost prohibitive, but sometimes there's opportunities in organizations that can help. Getting supportive counseling. Therapy isn't for everybody, but even if you don't think it's for you, maybe talk about it with a trusted friend or someone from your care team, because there may be some options that are more acceptable to you. Sometimes they have short-based, brief intervention therapies, 3 sessions, 6 sessions, to really focus on something pretty specific that's, more worrisome than not. Some, uh, care teams and facilities actually do have, educational programs around the fear of recurrence. Some have ongoing support groups, and that can be helpful, again, to be in that community of support. Some of this, again, it will be based in your cancer center, and some, may be more in the community. Some may be connected to your insurance, and there are some services that are free because they're offered by community organizations or other advocacy group. Check in with your nurse navigators. Nurses are awesome. I love our nurses and I love our nurse navigators. They're whiz, and our lay navigators at finding resources as well as your social work team. Communication. Um, and it's hard because sometimes folks, it's hard to find just the right person that you feel like kind of talking with about the diagnosis or changes in treatment and symptoms. But at the very least, please communicate to your care team because there could be referrals or resources we can connect you to. And if we don't know, it's going to be difficult to address those concerns. If you need professional help for just kind of the things that might not be directly cancer related anyway, but could be long term impacts if you're still dealing with fatigue or things like that. Can you get some paid or non-paid help at home? And those mundane tasks, like cleaning and yard work, etc. Psychoeducation courses. At Jefferson, we have our Patient Support and Welcome Center where we offer a whole variety of different programming. You don't have to be a Jefferson patient, it's usually free. Some things are online, some are hybrid, some are around particular topic areas, and sometimes that can decrease our worries and fears of recurrence because we're getting the information. Seeing ourselves as problem solvers and skill builders, that can be in a variety of different settings. Again, supportive therapy, family therapy, couples sometimes in those integrative therapies. Um, I just also want to highlight there are some national resources. We don't want people to suffer in silence and suffer alone. For some people, the fear of recurrence and psychological distress um, is very serious and can trigger a mental health crisis. Um, and we want you to be able to make sure that you get that support. So these are some crisis hotline information and text crisis hotline, some other cancer specific resources and community are always our lovely LBBC as well as some other organizations. Here are some specific population focused resources that offer therapy, sometimes programming, psychoeducational options. Uh, so those are things also to look at. There are a few app-based options that can be tools that are can be utilized to help you in the moment. Again, it's not a magic wand, but that can help you in the moment to be able to bring the temperature down, as they say, to Stop, Breathe, and Think, which is one of the apps. Calm, which I love. The Headspace, and the Mindfulness app. These different tools that can be helpful along your journey. So I've gotten to the end of my slideshow, and that is my contact information. So I will stop sharing now and see what questions we have. Thank you so much.
Thank you so much, Celeste. That was a great presentation. So many things resonated with me, and I am sure Shannon as well. So Shannon has now joined for the Q&A portion. So Shannon, if you would take a couple of moments to introduce yourself to the audience.
Yeah, it's such a pleasure to be here. And Celeste, thank you for sharing your time and such a wonderful presentation for all of us. So, I am so proud to be a Living Beyond Breast Cancer Young Advocate as part of the newest cohort. And I partner and work with, 20 plus incredible humans who have been such a huge part of my journey and my chapter here. And so thanks to Lynn and everyone at LLBC. I was diagnosed just 2 years ago in April of 2023 with stage 3B, ER/PR positive, HER2 negative breast cancer. I went through 16 rounds of chemo, double mastectomy, lots of nodes, 25 rounds of radiation. And as I was sharing with Lynn a little bit earlier, I am now in the height of my hormone and endocrine therapy of chemically induced menopause and dealing with 2 to 3 different medications. Just had another surgery just a few weeks ago. And so this topic has meant a lot because for me, I've been very open in that survivorship has almost been harder. I don't want to say harder. Let me just use my words wisely here. Has been really challenging from a mental health perspective. Thank you. I just saw Alexa put up a story I had written recently, but I really just kind of chugged through and like goals and like a good pace, and I moved quickly and I could just move through knowing that there was the next step of active treatment. And when I really had to sit with things and pause, that's when I really had not a hard time, but I really had to feel these feelings and figure it out. And I see Celeste nodding there and Lynn too. And so LLBC has become a huge part of how I've been able to cope and connections and making those connections. So for me, it's been now that I'm trying to focus. I think there's also so much emphasis on the physical aspects of how you cope. Don't eat sugar, don't drink alcohol, do this, do that, and all these do's and don'ts about what you can be doing for your body. And I think there's a lot less talk, particularly sometimes with your own care teams around the mental health aspects and resources. So I really had to go out there and piece together my team, and we could talk more through questions. But that's really my story. I'm from Philadelphia, proud Philadelphian, but I now live in Pittsburgh, and we are raising our family here, our 2 young boys. So we also had a 2 and a 4-year-old when I was diagnosed, and that's also another part of my experience that I've been working with. And so hopefully that's a good introduction, and happy to answer some questions and be a part of tonight's conversation.
Thanks so much, Shannon. I think the first question I'll phrase the question that came in, but I certainly think this is so universal in so many ways. Shannon and I were, I think, talking about it too before we came on. While I look forward to finishing my 5-year course of Arimidex, how can I handle the anxiety over no longer taking an anti-cancer drug and then suddenly feeling less protected and that fear of recurrence even stronger?
That's such a great question and such a common experience. So first I will say to that question and those who may resonate with that you are certainly not alone in that. I think part of it is it's going to look a little bit different for everybody. But there is a strategy, and I'm leaning a little on cognitive behavioral therapy and put my little therapist hat on because I do that as well. But there is a piece called cognitive restructuring, right? Those are the scripts and stories we tell ourselves to ourselves that are kind of running in the background. And that's in some ways what worry is and anxiety is. It's a script and a story of what you are telling yourself about what could happen in future events. And sometimes what is helpful in a process, whether that's with a therapist, with your care team, with your loved ones, of developing an alternative, believable, fact-based story that you can also tell in script you can tell yourself that will be as valid and as useful that you can use in those moments of worry. Um, I kind of broke down cognitive restructuring therapy in like 30 seconds, but in some ways that is one of the implementation tools in that way. Um, and it is usually most helpful if it is honest and kind of holds both the uncertainty in one hand that is real, as well as what other fact-based information you may be able to get from your care team. That, the evidence shows that if I take it this long, that this percentage really is helpful for me. And, this is why my care team suggested that. But it has to make sense to you and your words too. So
Yeah,
hopefully
and I
that
think
helps.
yes, and I think it's just validates like that is real. Like when you suddenly, Shannon and I were talking about before, like, years ago when suddenly I was like, I'll see you in 6 months. And I was like, okay, I guess I should feel good about that, but right now I just feel really scared. And I know,
Mhm.
again, Shannon, you had the same response, but thank you for that. And Shannon, do you want to take the next question?
Yeah. Hold on, I'm looking for the questions right now. Sorry about that. Um, okay, I see on here. We have Celeste, you really struck a chord when you mentioned finances. Most of the alternative treatment choices I'm interested in are not currently covered by insurance at all, or maybe only partially. Cryoablation was a fabulous, psychologically comforting and effective choice for me for the first time. I will choose it again, but can't get supplements paid for either. So can you speak a little bit to that, Celeste? And I'm happy to jump in as well, just because
Yeah.
I did use an integrative oncology at my cancer center. So Celeste, I'm happy to chime in
I
after you.
Yeah, I'll make mine really brief because I really would want to hear your story too, because that's probably most resonant for the person who asked the question. But I'll just say, yes, it is a key piece of advocacy that we need to push insurance. Right now, what we have in the United States is an insurance-based healthcare system. There's huge disparities, one with people not being able to even have access to insurance or having insurance that doesn't cover all of the treatments. Even when certain treatments are covered, they're cost prohibitive because the percentages of reimbursement and patient responsibility. So it's a huge piece of advocacy that I think we all have a voice in and not being siloed by ourselves. Um, but also check in with the nurse navigators, social workers and care teams. Sometimes we have a little tricks and ways to try and get around some things. That's not really what it should be. Equitable and open and accessible to all. But sometimes folks who have been doing this for a while have ways or organizations we can refer to. But I definitely want to hear your story, Shannon.
Yeah, no, I think it's all of that, right? So, for me, I really wanted to seek out all the resources that I could early on in my diagnosis, just to sort of understand what was out there. I was fortunate to be in an urban um, at a cancer center that's also a research center, and so this integrative oncology has been a big piece of it. Um, and so they offer some free services there for your first month or two. And then you could work on what that could mean to sort of pick and choose what you could do throughout your own um, chapter and survive and doing that. I also there were a lot of local organizations. So in talking with my nurse navigators, just as Celeste mentioned, there's Cancer Bridges here in Pittsburgh, and I know there's been a whole scroll of a lot of organizations people have been mentioning in the chat, which has been really helpful. I'm not one to sort of like reach out for help, but I really wanted to make sure I could understand what resources I had to help and think about that. And to me, having all that integrative sort of oncology and those things really did help with my anxiety. I have general anxiety prior to cancer. And so for me, these were coping mechanisms and things that I could use to help me with that. And so I would say I just sort of use those resources for not only myself, but for our children and for caretakers. And I think that it's also good to think about those relationships immediately around you. And so all of that integrative pieces and putting those teams together were really important for me and the team around me and my family who was supporting me as well.
Mhm.
Thanks, Shannon. I know I stumbled into a lot of things by accident. And I think, to your point, Celeste, it's so hard when you need to sort of piece it together, but sometimes that's what you need to do, get say a resource, from my cancer center had resources. I was, again, part of a clinical trial in mindfulness meditation art therapy that I literally stumbled into. They had a flyer in a hair salon, of all places. Um, but I know there's cancer support community. I know people have mentioned in the chat Unite for Her. So there are different resources. I know for me, meditation really got me through, and I continue that to this day. I know you mentioned other resources. I think Insight Timer is also another one. I don't know if that was mentioned, but almost all of the meditations there are free. And I
Mhm.
think it's piecing it together and finding what works for you. And sometimes that takes time. And
Mhm.
not only does it take time, but it's just trial and error to sort of
Mhm.
see what that is.
And Lynn, we did talk earlier a bit about that whole person care and building
Mhm.
sort of like a comprehensive team almost. And I think for me, that was really important. It wasn't just my care team and my oncology team. I really had to build out and figure out what resources meant for me. Yoga was my saving thing. I found it again through the integrative oncology. I had this incredible yoga therapist who really changed my path. It's an, an everyday thing for me, similar to the mindfulness, but a therapist, a yoga therapist, and just figuring out what that comprehensive team means to
Mhm.
you, right? And what works for me and for Lynn might not work for you because it is so individualized and so personalized. But I think it's so important to know that there are resources and just to think about that holistic part of this. This is a great example, but I when I moved, I was pregnant and I was seeing the midwives and they were wonderful for my pregnancy pre-cancer. When I went back during cancer and post-cancer, they were not the team I was working with was not as educated about tamoxifen and all these
Mm.
drugs and just I felt a little bit scared to be there with them Googling, like, I don't really know about this. And so in a few weeks, I'm meeting a new midlife specialist, OBGYN,
Mhm.
who's now going to help me navigate all this menopause and all this new things. And I just recognize like
Wonderful.
I'm not the average patient and I don't want to use normal or average, but I'm no longer just going there for my annual. Like I am now dealing with a lot of different things and a lot of different thoughts and processes and things. And so it also just encourage you to keep thinking about that as you go through different phases.
Yeah.
Absolutely. Absolutely.
Thanks, Shannon. Someone actually had just in the chat said I needed anxiety drugs, and
Yes.
sometimes, Celeste, I know,
Yeah.
I did as
Yeah.
well.
And that's a great point. I do want to
Yes.
bring up several different cancer centers have, again, I kind of mentioned this term psycho-oncology or psychosocial support. There are psychiatrists, psychiatric nurses who specialize in working with folks who are going through or have gone through a cancer experience. And, you know, there's a lot of chemical things happening in your body when you are getting chemo, when you're doing radiation, even with surgery only, a lot of is going on. So your whole equilibrium is off. It is okay. It is absolute. There's a lot of stigma around psychotropic medication, which we are kind of working on, but it is absolutely okay to get prescribed those, get assessed and take those medications if you need them. Um, it may or may not be for a long period of time, but sometimes even just kind of opening up the possibility in your mind for some people, the framework of I may only need it for a little bit of time maybe makes it more accessible if it's something that really has not been something in open to them at that time. So it's okay to look at it like that too.
Yeah,
Everybody needs a little help sometime.
We
Um,
joke, but one of my breasty conversations on a text chain where we call ourselves Ativan always, because I do feel like even now there's certain anxiety times and times where I feel like you need that. And I think also speaking with your team about what other medications you're taking, depending on your subset and your subtype, because some of this could interact and they might make a different recommendation. I changed my anxiety medication of what I
Mhm.
was taking before cancer and am now taking one that also helps with hot flashes and helps with all these other things. And so I also was open to changing and being open to that. So I think that's really important to mention.
Thanks,
Wonderful.
Shannon. So another question that came in, and you touched upon this, Celeste, in your
Mhm.
presentation. I'm hoping to hear about specific things that reduces anxiety associated with having a genetic mutation when you were going through your presentation.
Mhm.
Doing all the surveillance can be empowering in a way, but I think the experience of living the rest of your life with these risks is so heavy. Can you speak to that?
That is such a great question. For some folks, uh, finding a community of other support, so Force, which is an organization um, and I am blanking on everything that the acronym stands for right now, facing our risk. Something, something. I apologize. I can't remember all of the acronym right now, but kind of finding a community of support and how folks kind of manage again, that paradox of there is some quote unquote, I'm carefully saying it, certainty in having that genetic mutation in terms of expectation and a schedule of when to have surveillance, but there's so much uncertainty that comes with that. How do you both face that risk as well as live beyond or not all encompassing of that risk, which is kind of the balance of dealing with anxiety anyway, right? Kind of generalized anxiety or very specific anxiety, even up into panic. And I think, Shannon, you mentioned scanxiety, which some folks do have kind of almost an acute anxiety attack or panic response as their scans come up. So sometimes that may mean medication to help kind of uh, even out those highs and lows that at particular times. It could be talking to your care team about what is the newest kind of schedule. Is the schedule that you're on for surveillance the most up to date? Does that work for you? Does not work for you? Can you cluster? Do you want it spread out somewhat differently? What can your team kind of tell you about the newest and latest, and how can that work in your life and schedule and how you're processing it to give you a little bit more predictability and control, if that makes sense. So hopefully that kind of came up with a few tips.
Yes, and the Caroline put force
Oh, thank you. Thank
in the
you.
chat. So
Thank you.
I'm going to do a next question, and then I'm going to turn it over to you, Shannon, for another question. Is it normal to be jealous of all my friends who never had a health concern ever? I feel terrible for feeling this way, but I feel that they think I'm crazy if I even express that.
That is very, very common. And that means you're human. You and a couple other billion people on the planet probably had that thought. I think that is part of the human condition. We kind of process our own emotional experience and understanding of the world vis-a-vis our interpersonal relationships. Remember that kind of social ecological model little schematic I had up there. So you're going to see yourself in relationship to others. If you process through that, give yourself some grace and some kindness for being human and feeling what you feel. If it becomes bothersome or disruptive to your interpersonal relationships, you may want to sort that out either with that person or with a therapist. Um, so that hopefully that helps.
Thanks, Celeste. Shannon, next question.
Yeah. Hi. My oncotype test came back with a score of 57 after a mastectomy, which means there is a higher risk of reoccurrence. It has been a year post surgery and chemo. I worry about that number for reoccurrence. I feel like I'm at a higher risk. The thoughts can be debilitating.
Mhm. Um, Thank you so much for sharing your journey with that and kind of where you're struggling with that. those, that the whole issue of kind of newer science and technology, again, in that Anka type score, um, and is that more helpful or less helpful or more hurtful to an individual? Uh, and sometimes you can't put the genie back in the in the little Aladdin's lamp. Once you know the score, those thoughts and that understanding is there. So sometimes, again, it's about kind of managing that with a little bit of predictability and control, knowing that it's there. Again, what are the um, things that your care team has told you to look for? What is your scan schedule? What is your kind of exam schedule? Is there kind of a happy medium? Is your schedule every 3 months? Are you every 6 months? Can you advocate for yourself? If even the care team says, "Oh, I'm ready," you're ready to go every 6 months. If you feel based on what you understand and information you have and who you are, can you advocate to the team? Really, is there any way that I can modify my schedule? Because I really feel like for the next year, it should be this. Attend programs such as this. Become an advocate. There are different programs where you can become a research fellow or involved in some of these things, and you can kind of pick the brain of sometimes clinicians other than your care team to get what's up on the science, and that may help. It might not, fix everything, but it may help enough around the edges to help you get a little bit more sense of kind of evenness and calm.
Thanks, Celeste. Someone had a question, and I know this could be a little bit more medical, but what about the fatigue and chemo brain factors? Approximately how long to expect these to continue? They're avoiding a book club for struggling, how to find words when speaking on the fly. Obviously, that is physical, but it's also stressful and anxiety
Yes.
producing.
Yes. Post-treatment side effects are a very big deal, and neuro post-treatment side effects are a very big deal. Now, there are some cancer centers across the country where there are now new kind of sub uh, clinics that really are looking at that and strategies, along with neuropsychiatrists and psychologists, folks who are doing research to one kind of identify the phenomena, rule out any physiological symptoms that can be address pharmacological symptoms by tweaking medications that may exacerbate some of these issues. Um, Nutritionists, these multidisciplinary. They're not everywhere, but they're coming more and more. Um, it has been something, again, that advocacy piece, and that's somewhere kind of going to some of the vetted groups online, and you can find where some of these centers are, or asking other survivors, where they've gone to get, better attention and help, because it's real. And for a long time, I know survivors and patients have said, and I, can really hear what they're saying, that the medical community was a little like, shh, like, be grateful, we quote, quote, that, you're cancer free. So what if you have these kind of long-term debilitating side effects? Hey, uh, and there's been that tension. So kind of advocacy for and attention to physician champions, nurse champions, social workers, other care team who will really try to address for treatments. Interestingly, and I would have to find where it was. I was doing a talk a couple years ago. There was a little bit of convergence around some of the research that was happening around long COVID and um, long-term side effects with chemo brain um, and strategies. And it may be on the American Psychosocial Oncology's journals. That's an organization I'm connected with. It might have been in a journal article I saw from there. I'll try to do some research, but I do know that there was something that came out of that. But there are some centers that are focusing on that. So ask your care team, uh, do some research.
Thanks, Celeste. I'm going to pose this to you, Shannon, and then I'll answer it. How did your friends and family react when you told them that you had cancer?
Um, you know, it was all over the board. I would say the first month or two was the most overwhelming, and also like for me, the truly some of the scariest parts of it, just because I had to have PET scans because I was had positive nodes, and that just led to additional testing and things we had to do. And I really kind of shut down and didn't know, even though I'm a very outgoing person, it was really hard for me to sort of process it myself and figure out how I was going to sit with this. Um, I learned pretty quickly and got some advice and just started talking that like writing was really helpful for me. And so I started using Caring Bridge as sort of food train, but also because I could write updates and people could read them. And I didn't have to be overwhelmed because I was getting so overwhelmed by messages and thoughtful, wonderful, which is great support. And I'm grateful I had that. But it was almost too much. And I couldn't just keep cutting and pasting things. And so that was really my way to start being able to handle how friends and family were reacting, keeping in touch when I was getting questions. And that has really turned into a huge surviving mechanism for me and coping. I do a lot of prompts and writing with Wildflower Magazine. I journal a ton. And that all came out because of that early sort of reaction from friends and family. I also worked for most of the entire time of my treatment, with the exception of surgery. I took a few weeks off. And I remember very clearly someone saying, like, assign a work captain, have someone at work that can be your person, that when people at work also are checking in and want to know how they can help, that they can go to your captain and that person can be really like your advocate. And that really helped me a lot. So I would say that my friends and family, this came out of nowhere. I have no genetics, I have no family history. My mammo saved my life. Like there was a lot that happened, and I think people were shocked. Um, and I really had to work through that. But I think I had to figure out how I was going to deal and do that. So I hope that that's helpful in how I had to sort of that first few weeks of what it meant for me to talk with them.
Thanks. Thanks, Shannon. Um, when I was diagnosed, I was single. My mother had just passed away a few months earlier. My father was still alive. And I kept it from my father for a little bit because I felt so guilty that I would have to tell him. My mother also passed away of a different type of cancer. Thankfully, my sister, she was a nurse by trade, although she wasn't actively nursing then, but once a nurse, always a nurse. And she really was by my side every single appointment. And really, I didn't want to know a lot. I just was like, what are the five things right now in front of me? Maybe five was too much. I should say, what is the one thing in front of me right now? Um, and she really kept the family in the loop, kept my friends in the loop, and really reminded me too of like, remember, Lynn, you had that. Ask that question. Or she would ask it for me at during the care team. So I also worked full time and really had the support of a wonderful workplace who was very accommodating, and I was very fortunate to have that too.
Yeah. Wonderful.
So.
And yeah, those resources such as Caring Bridge are really wonderful. I usually do tell in s- you know, some people kind of like to use social media. One thing I caution people to think through that, because once things are out in social media, you cannot retract them. And Caring Bridge and some of these other portals, it's out there, but it's a little bit more secure because it's HIPAA compliant. And also, it is okay to tell as much or as little of your story as you choose. Having a designee, though, sometimes is helpful. Even if you're, totally analog, nothing online, but to have a sister or a cousin, or like, this is the person who I'm going to tell, or is going to be with me at appointments, and this is what you can tell everybody else. What is the acceptable limit of information? It is okay to say, this is how I want kind of inquiry in. Um, it can also be a challenge, and I don't know if either of you can speak to it, where sometimes folks in that circle support are a little bit disappointing. The people who you might have thought would kind of rally didn't necessarily rally, and then there's some unexpected surprises, and that can sometimes impact your feelings of distress.
Very true. That's what I'm going to say about that. I think that is, you sort of said it in a synopsis. Some people really surprise you, and some people you might be disappointed by. And then you decide sort of what you want to do within those relationships. And it's all okay, and you get to choose.
Mhm.
So, um, I'm going to take one more quick question, and then I'm going to sort of wrap up. Um, I personally feel awkward as I face a reemergence back into society after completion of my cancer treatment. I don't feel normal, but people are starting to treat me like I was never sick. And I still face many health issues related to treatment, and I feel like I don't fit in. I feel like there's needs to be more discussion about this period of the cancer journey and its effect on mental health. Do you want to comment on that, Celeste? I know we've been talking a lot about that.
Absolutely. So I think that that really does sum it up. Normal isn't normal anymore because you've had this significant life altering event. You've gone through a transformative, invasive, disruptive, to all aspects of your body, mind, and spirit experience. So you're gonna look different on the other side. You're gonna feel different. But the people around you aren't necessarily going to know how to respond to that. We can give them some grace of not knowing what they don't know, but it is okay for you to, feel different or feel like normal isn't normal anymore. But you can come up with a new normal. And sometimes that journey, maybe some of the tools like Shannon mentioned, journaling, the creative arts expression, things like Lynn said, mindfulness, kind of getting in touch with yourself of who this new person, this new you is emerging on the other side and saying, okay, this new me, this is what I need from you. And this is how I need you to support me differently because this did happen and it was a big deal. And here I am. See me as I am now.
I also think it's okay to admit, for me, it's like admitting to myself, like it's okay to not be okay just because like they say that I'm out of active treatment and I should be okay. And some days are worse than others. I mean, like I've been really struggling with like sleeping and the night sweats and just like not having a good sleeping foundation. And I'm tired and I feel really exhausted. And it's okay for me to say that out loud, right? Like, and to accept that and to
Absolutely.
figure out how I deal with that. So I think it's also giving yourself that grace to be able to say those things out loud and just know that, like, survivorship for me, like, I've accepted that it's this forever chapter and there's going to be ebbs and flows of lifetimes and different stages of medication and post-treatment medication and not post-treatment of checking in and just what that means. So, I think figuring out what that is for you is really important. Um, but yeah, it's hard. It's hard to sort of reemerge and find that new you and to accept the new you. And I think I'm still having a lot of issues and challenges because I am just now 1 year NED and 2 years from diagnosis. And there are many days that I don't recognize the new me. And that's been really hard, not only just physically and how I look and but like how I feel. And it's like, God, I've had to like reinvent myself so much, like so much over these last few years. And what does that mean? And I'm still working with my therapist and lots of other people through what that means. But yes to everything Celeste has said.
Yes. And I compare it to, it was like I'm trying to fit a square peg into a round hole after my diagnosis. So I think we're just all trying to figure it out. And like you said, Celeste earlier, sort of choosing what works, because it's different for everyone. So I want to thank you so much, Celeste, for joining us and sharing your
Thank you.
expertise. This flew by. Thank you to Shannon as well for sharing her experience and helping moderate tonight's program. Again, it was just a great discussion with lots of helpful information.